Blood culture collection procedure. It is important to strictly follow this blood culture collection procedure. The most important factor that affects blood cultures is blood volume. For adults, we recommend 2 collections of 10 ml each, drawn from 2 different venipuncture sites and transferred to 2 adult bottles. For children, collect a volume of 2 to 5 ml into 1 pediatric blood culture bottle. We recommend collecting at least 1 ml of blood per year of age. Ensure antisepsis is strictly adhered to. This is to ensure bacterial skin contaminants do not enter the blood bottle. As much as possible, collect blood cultures before administration of antibiotics. The blood culture bottles seen in this procedure have been prepared at the University of Health Sciences. Procedure for collection of blood cultures. Preparation. Use the checklist to see if you have all materials needed for the procedure. Materials needed. Blood culture request form. 1 request form is required for 1 set or 2 bottles collected at the same time. We recommend to sample from 2 separate puncture sites. For adults, 2 adult blood culture bottles. For children, 1 pediatric blood culture bottle. Rack for blood culture bottle. Alcohol hand rub. 1 pair of gloves. Tourniquet. 2 alcohol single-use pre-pads. 2 gauzes. Betadine. 2 needles. For adults, 21 gauge. For children, 23 gauge. 2 syringes. For adults, 1 syringe 10 ml and 1 syringe 20 ml. For children, 1 syringe 10 ml. Band-aids. Sharps container. Small plastic bag for contaminated waste. Ask the patient's name and check that the name is the same as on the laboratory request form. Write the following information on the blood culture bottle: patient's name, age or date of birth, sex, hospital number, date and time of blood collection. Mark 1 label with R for right arm, the other with L for left arm. Inform the patient of the procedure. Clean your hands with alcohol hand rub. Position the patient and select a puncture site on the arm. Apply the tourniquet and ask the patient to make a fist. Antisepsis of skin. Clean the patient's skin at the puncture site with an alcohol wipe. Start from the site you will puncture and make circles to the outside. Wait 1 minute for the alcohol to dry. Take gauze with betadine . Wipe the puncture site. Start from the site you will puncture and make circles to the outside. After this procedure, do not touch the puncture site anymore. Allow the betadine to act for 2 minutes until it's dry. Remove caps from the blood culture bottles. The bottles should be placed in a rack. Wipe the rubber stopper of the bottle with betadine. Leave to dry for 2 minutes. Put on a pair of gloves. Prepare the syringe and needle. Collection of blood. Puncture the vein and collect at least 10 ml of blood. Remove the tourniquet as soon as the blood flows. If the venipuncture is not successful, use a new sterile needle. If you touched the puncture site again, repeat antisepsis. Do not touch the sterile needle with a finger or gauze. Press the gauze on the puncture site. Transfer the blood into the culture bottle. The bottle should be placed in a rack. Remove the syringe with needle and put into a sharps container. Do not recap the needle. Do not separate the syringe from the needle. Mix the blood in the bottle with gentle movement. Use an alcohol swab to clean the betadine from the puncture site. Put a band-aid on the puncture site. For adults, repeat the same procedure on the other arm. Use a new sterile syringe and needle. There is no need to change gloves. In case more than 10 ml of blood is collected for culture and other laboratory tests, respect the order of filling. Always fill blood culture bottles first. Other tubes are filled afterwards. Clean your hands with alcohol hand rub after the procedure. Transport sample to the laboratory. Check if bottles are labelled correctly. Transport the blood culture bottles with the laboratory request form to the laboratory immediately. In case of delay in transport, never store blood culture bottles in the fridge. Store only at room temperature.